I'm a patient at Anatara. My name is Kelly Vale. I was diagnosed with stage 4 breast cancer in my bones in February of 2022. I had a vertebrae fracture and collapse. I was in the hospital. It was excruciatingly painful. That's how I found out I had stage 4 breast cancer in my bones. I explored what my choices were through my doctors, and I was told by my oncologist, here's a prescription, we'll give you a couple months, and here's radiation, which will treat the cancer, but it will also kill the cells in your bones that will help your bones remodel. And that was pretty scary because my L2 vertebrae had collapsed, and they were really telling me that I needed to be careful as far as paralysis. I started looking at what my other choices were, because being told to take a prescription and go home and look at 10 to 18 months of life, I was 44 years old. I chose to go to Mexico. I wanted to look at something that was more aggressive and had a better outcome and was really more active. I went to Mexico and I spent 3 weeks in an inpatient clinic there, and I had great results. I came home. I went there in a wheelchair with a back brace, and I came home walking. And my cancer antigen numbers had improved significantly, but they weren't into a normal range. But I came home after 3 weeks and was feeling very good, and kept after the program there to see if I could completely go into remission from the treatment there. In October of 2022, I went back to work, which is pretty amazing. But my numbers were still active. They just weren't, keeping me from living a full life. In December of 2022, I had a PET scan, and all 11 lesions had returned. My energy level had dropped. I was having problems standing. My endurance was really weak, and my antigen numbers had started to increase. They were no longer stable. By the end of December of 2022, my numbers were accelerating very quickly. One of the lesions is in my left jawbone, and right between Christmas and New Year's, my left jawbone had cracked. And what that means is, like, my bite was off, talking was challenging, my teeth would hit. And as you can see today, I can talk, I can eat, my jaw is healed. In December of 2023, I had met with my naturopath. I had discovered the RGCC data report that's out of Greece. And my naturopath was encouraging me to look at what are my other choices available to me. And I took this RGCC report, which said, hey, your circulating tumor count is increasing and you really should take action. But by the way, here is your profile of your cancer. Here's what it's going to respond to from a chemo agent, from a natural agent. And then here's what its profile, what it looks like. I took this to my oncologist, and she looked at me and said, Kelly, I don't do any of this. I can provide you a prescription. So I started to looking at my other options, because I knew what was possible because of my Mexico experience, but I wanted to look for something that had results that was local, but really holistic. And I found Anatara through a Google search. I brought my RGCC report with me, and I met with the medical director, who immediately kind of went through and said, hey, breast cancer in the bone, here's our approach to that. Here are our international best practices that we incorporate into it. Here is our path forward. It's not going to be a quick, like, in and out. It's going to take some time, because in the bone really requires some aggressive treatment. But there's hope, and there's referenceable clients who have recovered and regained their health and retained quality of life. So I was quite excited. I talked to my husband, and he said, let's be aggressive. Let's do this. So one of the things that I find critical is Anatara's approach. They're not just treating cancer patients. They treat many different diseases, but they also treat healthy people in optimizing their health. And what resonated with me was the approach that they looked at the whole person, and they personalized the medicine. They use data, so it's data-driven, personalized, and it's more than just like my physical health. It's my lifestyle, it's my emotional health, it's the stress. They take that into consideration and say, let's look at that. But it's also integrating international best practices. And I think that's important, because when I look at the American healthcare system, It has a standard of care and results that are not inspiring. And why not look and say, what else is the rest of the world doing? Cancer isn't just an American challenge. This is something that's going on everywhere. And so the fact that they take those things into consideration and make them available here resonated with me. It's also delivered by a team of professionals. It's not one doctor saying, this is the way it is, this is the only way it is. I know that the staff, whether it's the medical assistants, the nurse staff, the acupuncturist, the functional medicine, the naturopath, or the medical director, they're having conversations about me on like, how is Kelly responding? Is this working? What works best for her? And the conversation is about my data. Like, it's not just like, oh yeah, we got your lab report. No, it's a conversation. We got your lab report. Are you responding to treatment? What are things I could do at home? Do I have homework? What are things that we're going to adjust in our plan? It really feels like it's about me. And I know it's about me because we've run the labs, we've done the genetics, we're having conversations about how do I sleep? What am I eating? It's amazing, like this is about me. But when I go to my traditional oncologist, I get labs. They kind of look at them. I get delegated to a nurse practitioner. It's just very sterile. But when I come to Anatara, there's eye contact. There's people who are happy to see me. It's kind of like Cheers. When Norm walks in, they're like, oh, they know you by name. And they don't go, what's your patient ID? What's your insurance number? They're like, oh, Kelly, we're expecting you. You have a plan. We have you set up in this room. Here's what we have scheduled for you today. And it's a conversation and it's human. And it's not take these 2 pills and I'll see you in 30 days. It really feels like engaged personal care and that they're as equally committed to my success and my return to health as I am. But the thing that really strikes me with somebody who has a stage 4 cancer diagnosis is quality of life. Is the treatment going to improve my quality of life? Is it going to diminish my quality of life? Is it worth it to do it? And what I find here at Anatara is quality of life is part of the plan. Am I nauseous? Am I not sleeping? Am I constipated? Those are taken into consideration. Does this treatment make me feel, out of my head? How exhausted am I? Whereas the other treatments, I've been told, we don't know what it's going to turn out like. Take these pills and your quality of life is unknown. Whereas the treatment here includes, do you feel good? What can we do to make you feel good? And it's not a pain management plan. It's not like, hey, we're just going to give you a bunch of pain meds so that you could, suffer through this. It's actually, do I feel good? And that is important because with a stage 4 diagnosis, sometimes you need to make that choice. Is the treatment worth it? And what we've done here, absolutely worth it. 8 months and I can do so many things and I feel really, really good and I'm not in pain. And if I look at my case specifically, I came in here in January and my stage 4 cancer numbers were accelerating. My quality of life was diminishing. And you could say I came in because the house was on fire. And they're like, sweet, we're going to treat cancer. We're going to treat the cancer, but we're going to treat it from many different facets. They looked at it and said, okay, you're heat sensitive. It has these specific proteins on the cancer cell membrane. It has these other factors, and they treat it from all these different perspectives. So it's not like a single treatment and send you home. It's really comprehensive, but they don't stop there. And I think that's important that I have not experienced anywhere else. They're like, what about our immune system? They've discovered that my immune system was compromised. No one had ever looked at my immune system and said, hey, you have a compromised immune system. Why is my immune system suppressed? So then we looked at it and said, what can we do to support our immune system? But then why is it suppressed? So then we looked at underlying conditions on why is it suppressed? Why has no one ever looked at why my immune system isn't working? I should have a fully functioning immune system. So then they looked for underlying conditions and they looked at everything from viruses, parasites, mold, and genetic testing. And I come to find out I have high mold toxicity. I had no idea. And guess what? High mold toxicity looks like somebody who never gets sick. Why? Because their immune system's asleep. And you don't know it until something takes you out like cancer. But they didn't stop at oh, she has mold toxicity, let's detox. They taught me how to eat to detox from mold, look at my environment, how to actually treat it here, but then looked at Was it an acute exposure? Was it a one-time thing? Or is she actually really sensitive to it? So they went to the next level of teaching me that I actually am genetically super mold sensitive. No idea. And the mold sensitivity, I'm going to have to pay attention to the rest of my life so it doesn't suppress my immune system. And that multifaceted, many-layer approach by far sets Anatara approach. They have referrals to groups outside of what they do and other practices, but when just the approach of looking at it and going like, she's got cancer, we're going to treat it, many facets. We're going to look at her immune system. We're going to look at underlying conditions. We're going to look at her lifestyle. I am in a medical menopause state, and which includes hot flashes and night sweats. They help me fix my sleep. Sleep is when you restore and heal. We looked at my nutrition. Do I have malabsorption? Am I getting the nutrients that I need? What does my body need? They taught me how to eat, to look for inflammation, to look for blood sugar management, and to look at things that are optimizing my health. And then what are my genetic predispositions of, like, for example, I'm always going to be low on magnesium. I should really pay attention to my magnesium, or things like that, like really educating me on me so I can optimize my health and not just recover from cancer, but really become somebody who's educated and caring for themselves. And I think that's really powerful that no one really talks about. And that visibility to that multifaceted approach is really something that I would attribute to how their patients recover. And the other part is that people don't really talk about is humans need connection and support. And the way the Anatara team comes together and they're aligned around a common vision and connection, like, it makes you feel like you're walking into a group of people who they're healers. They want you to feel better. They want you to feel good. And that sense of comfort and like give it is powerful. I'm not a number here. I am Kelly, and they know me, and they know my husband, and they know what lights me up and makes me excited, and they celebrate my birthday, and they celebrate my milestones in healing. And to me, that's just another level of human experience that is overlooked in the system. And I'm so grateful for that, because to overcome something like this and really heal, it should be celebrated, and it should be celebrated with people who care. So I want to acknowledge the team as well. I've done amazing, and I've done amazing because you guys have taught me, and you guys have been there and like held my hand. And like, to me, there's just something there. Like, I love the fact that no potential therapy with results is overlooked. I love the fact that there's a lymphatic bodywork option, that there's acupuncture, that we are looking at the Weber lasers, which I look at. I know it's biophotomodulation, but I look at it as quantum physics and the very fundamentals of, light particles. I love that we have functional medicine and we're looking at nutrition. Like, it's the whole gamut, in addition to how do you maintain quality of life and how do you use natural things as well as pharmaceutical things. Like, it's a whole approach is super powerful. So one of the things that comes up is like, why do I continue to come to Anatara? And I think there's two answers. I think the easiest low-hanging answer is results. And it's not just results on the cancer level. There's the gold standard cancer markers are excellent. My immune function is excellent. My quality of life is excellent. So the results are there. Why would I change path? Like, we're so close. I'm going to continue. That's amazing. But there's more of a human answer, and there's an experience of personalized medicine here. Like, we know my cancer profile. We know my body profile, my genetic profile. And the healing professionals who are around me to help me thrive and bring me, back to health, like, there is an experience there that once you've experienced it, it's really challenging to go back to a practitioner's office who doesn't know who you are. They don't know your name. They're not really sure why you're there. And it's more of like a speed dating experience where it's like super fast. We got to go through our checklist. I even laugh with my primary care physician. She's like, Kelly, it's completely just how it is. Like, I've got 15 minutes to hear what you say, make a recommendation and a diagnosis, and I have to keep moving. And I love my primary care doctor. She's incredibly sweet, but she's very honest about the way the system is. And my oncologist office is even worse. like from a personable standpoint. And she's a really wonderful person doing the best she can, but she's honest with me. She's like, I write prescriptions for pharmaceuticals. That's what I do. Okay. So to be able to have a team of people who really are looking at my health on many levels and my data and are all focused around getting me to that point of return to health, I can't imagine going anyplace else. It really matters.